Thank you, Jacqueline, for the warm intro and all the many intros you've been so kind to do ahead of this. It's really pretty special. So I'm a forever fan of Health High and look forward to hopefully meeting each of you at some point here. But yes, I'm pretty much fresh off a trip, a Disney cruise up through Southeast Alaska, where I visited a bunch of cities that I mentioned earlier, Juneau, Ketchikan, and Skagway, and really got to experience the beauty of the Alaska land and the people, but also got to experience some things that I wasn't expecting, like a lack of cellular phone coverage or other access to types of services, especially what I learned is in-person services. After seeing how spread out things are, how that is really a gap, and it could be potentially a vulnerability. So part of what we do at MapHabit is virtual care coordination and coaching and education for families, for family caregivers, or for individuals themselves who may have a neurodegenerative condition like a traumatic brain injury, or they may have an intellectual developmental disability like autism or Down syndrome like my niece, and then also Alzheimer's disease and related dementias is one that is very close to my heart, and my co-founder as well. Dr. Stuart Zola, he's a neuroscientist who worked at the Department of Veterans Affairs and a number of other places like Emory University. So want to just give you a little bit of a primer on the background, but I do want to make sure that we spend a good amount of time, to give you a little bit of background about MapHabit and what it's all about. So I have a couple of slides that we can start with, but I also have my tablet open too, which has the MapHabit system. So I want you to see in real time how someone might benefit from this assistive technology that really helps map out your day into bite-sized chunks where you can create these durable habits that you can personalize with your own environment that you're living in, so that you could be more independent and have access to some of our experts on the behavioral health side. So once again, my inspiration, or at least one of them, is my Uncle Byron, who you see here sitting down. He was a huge mentor in my life. He got me my first computer when I was 11 years old, which then sprung board a career in teaching older adults and really the art of patience. Unfortunately, with my uncle, we started seeing some changes in his late 50s in the way that initially with executive function, calculating the tip on the bill, or potentially controlling his reactions when talking with people, who's losing his ability to kind of keep his temper. And as time went on, he would, start forgetting to take his medications. He started forgetting, various, things that we all take for granted, like, getting dressed in the right order and sequence. And, after a while, it just became too much for my aunt to do all on her own. But what I did learn from my Uncle Byron is he really lacked practical tools to stay independent and really self-direct his own care and do things more on his own and have that dignity and self-respect and that right to be independent. And a lot of that is really what motivates me on a day-to-day basis. Not only for my Uncle Byron, who passed away in 2004 from early onset Alzheimer's disease, but my 11-year-old niece, Michaela, who is living with Down syndrome. There's a lot of people that are now being impacted from neurodegenerative diseases. So just a couple graphs. This may be familiar to many of you, but Down syndrome life expectancy, fortunately, is on the rise. Nearly doubling in the last 30 years, which is wonderful. Also, the prevalence of autism is also on the rise. This may be due to early detection, it may be due to other factors, but the essence is long-term services and supports are critical for people with disabilities and those who struggle with age-related neurocognitive disorders like Alzheimer's disease. So why are some of these things happening, and what are some of the neuroscience or brain changes that cause these conditions? Well, let's look at the brain, the healthy brain, which you see on the left-hand side of your screen. On the right-hand side is a brain that has Alzheimer's disease, and not only is the size smaller, as we age, we shrink. The brain is no exception, but what is different here is you can see on the right-hand side, this is your everyday memory system. It's what you use for consciously recalling facts and information. What did I have for breakfast this morning? Did I take my pills last night? Who is the first president of the United States? A lot of those types of memories, they start not being able to consciously recall those pieces of information. However, there's another part in your brain. This is called your habit system. This is what you use for procedures and routines. You can think of it as the muscle memory of the brain. So something that we can probably relate to is driving a car. When you're driving your car, you're not consciously thinking about the lefts or the rights or how hard you're putting your foot on the accelerator. You're probably thinking about all the things that you have done or didn't get done throughout the day that either you have to do later or on the weekend. And before you know it, you're home. So it's that non-conscious memory system where you do things automatically or not, autonomously that we tap into through the use of these visual maps that I will show you here shortly. I'll give you just an example of how this may work with a fictitious family, Joe and Anne. Joe is a family caregiver, and his mother, Anne, has a dementia diagnosis who's fairly early stage, but she still has trouble getting through her activities of daily living. In this case, what we use MapHabit for is, meal preparation. She loves chicken quesadillas and can't live without them, but she now lacks some of that immediate memory where she can consciously recall the sequence in which to do things. So one way you can use MapHabit is to actually take pictures or videos of that routine and sequence them in a way so she can follow it. She can follow it either through our digital platform or through what are called visual maps that can be printed out as well. And you can see that there's basically, this is for dressing, but anything that we do in the platform is multimodal in that people learn in different ways. So you can have both, an app on your phone or your tablet, but you also can have paper-based printouts. And what this does is when we kind of work with you all or work with the community members, we basically will do a needs assessment. We'll understand, what's your background? What kind of environment do you live in? What are the connections that you respond to? And really what are your abilities and opportunities? And then we really map out this wellness plan and work with families directly in a remote way, but we still have licensed clinical social workers, occupational therapists, behavioral therapists that really drill into how to best support people when they are living in rural areas like Alaska. And what this does is, as you can see on the right-hand side, it helps with care coordination, with establishing preferences in a platform that everyone will know, and you can't always articulate the needs or desires of people, but when they are stored in a sequence of visual maps, you can really map out people's daily habits, and that improves quality of life, and it also improves independence. So just another example of this, the visual map for the chicken quesadillas. You can see it on the screen here. It really does sequence step by step. That's something we can do remotely, where we ask a family to take pictures in the platform, and we can build that map for them. It's actually quite easy to build a map as well. But really the power of it is once it's built once, yes, there may be some modifications or tweaks to it, but this is something they can use for a very long period of time to stay independent and really to give them the confidence that they may need. So as I showed you in my hotel room, there's also these paper-based printouts and the digital platform that can be used. MapHabit's platform is very plastic, as we call it, to kind of a play on the neuroplasticity concept, in that the brain actually can change and learn new concepts and ideas. And it's not just for intellectual developmental disabilities and Alzheimer's disease and related dementias, but we're doing some work with the Department of Veterans Affairs with traumatic brain injuries, which I know has touched some of the people on this call personally. And physical therapy and other types of mental health and therapeutic programs. It's an ocean of possibilities to sequence together step by step to help people stay and remain independent. I have a couple of customer or caregiver testimonials. I might just share those with you, Jacqueline, afterward, and maybe you can share this deck with people, because it's about 3 minutes, and I want to make sure we have enough time for Q&A. But you can see we work with a very diverse set of individuals, both on the ethnic and gender perspective, but also from an acuity standpoint, or the types of conditions that you have. A lot of different people get really great interactions with MapHabit. As I mentioned, both myself and my co-founder have had personal experience, but it's really my co-founder, who's a neuroscientist, that really helped us get on this track of evidence-based research, proving not just because we think it works, but actually implementing randomized controlled trials with organizations, and that fortunately has led us to win a national competition for the Dementia Care Coordination Challenge in 2019, and also to win a series of NIH SBIR grants, which for a startup, these are non-dilutive funding sources that really help us build the credibility, build really innovative aspects of our platform so that large populations with unmet needs can benefit from it. And really this year, we're starting to crack into the Medicaid space, and why I'm here is a payer conference. We now are covered in 3 states where MapHabit is free, both the app and the behavioral health consulting that we provide. And our goal is over the next year is to have about 10 states that we are partnering with, and ideally as many as possible going forward, because we really believe that this should be a free benefit to families, but at the same time, it's for us, we can't give it away for free for everyone, because it costs a lot to build a software platform and to build a company. But we really have a very strong mission where we want as many people as possible to benefit from this. So I'm going to just pause for a second to see if anyone has any initial questions before I jump into the platform to just give you a real world example of how it might work.
Jacqueline, can I ask you a question?
Sure.
So I noticed that you said that you have it included in the Medicaid waiver in Missouri. Is it? And you mentioned behavioral health. Is it included in the IDD waiver as well, or just behavioral health?
Great question. It's part of the assistive technology carve out as part of the IDD. So now in comp, it's part of, yes. So thank you. That's a very specific area, but it's an important distinction. Yes.
I have a quick question too.
Sure. Go ahead.
If someone doesn't have a waiver, how else can they access the?
Yeah, so we partner directly with private and nonprofit organizations. It's usually a subscription service where if you're a service provider and you're a therapist of some sort and going into people's homes, we sell licenses so that you can enroll an unlimited number of people and use MapHabit with your clinical team in a case management perspective. We also, work with area agencies on aging and, departments of health throughout the country We are in a few assisted living and home care organizations as well, and we're working to naturally be covered under the waivers and then partner with managed care organizations and various insurance companies so that that can be covered. But we don't quite yet have a B to C, so a direct to consumer model, just because we're still kind of vetting everything out in terms of what works best with professionals that do with it on a day-to-day basis. But I would imagine within a year, we'll have something where someone can go to our website and sign up on their own as well.
Hi, Matt. Thank you for this presentation. I'm curious about how this would work for those that are visually impaired or have other disabilities, since it is so reliant on the tablet, it seems like, or the printed papers. How does it work if they are near blind?
A great question. It's a growth area for us in terms of how we can better support those populations. I don't have a great answer right now, other than some of the best practices with building out these maps is to record audio in addition to the pictures and text. And we have an Alexa skill. There's an Alexa here, so I had to mute it for a second. So you can actually utilize Alexa to have access to the content that you've created on the platform, or that maybe a support partner or para has created, and then the individual who has who may be blind or near blind, they can utilize Alexa to get those cues and reminders.
Great answer, and obviously important question. Thank you so much, Melanie. Are there any other follow-up questions before we get a demonstration? No? Go ahead, Matt, and do a demonstration, and then obviously you've really engaged our audience, and so we'll spend as much time as necessary to answer questions. And we've got some really experienced people. I'm so pleased to see Lizette and Kim Champney here, especially. They know the details.
Fantastic. Well, great. So that was a picture of the platform, MapHabit. We have these managed tablets, just so you know, where it's locked down with just a few different apps that are on there. And naturally, MapHabit is on the forefront of that. But in terms of the home screen, I've got an individual named Harold up. In his case, he needs these cues and reminders to take his pills with water at a specific time. So in this case, the specific sequence of basically taking those pills, a caregiver will help provide that pill for him, and then he'll basically drink it through his water. But having that reminder that has to happen not only for him, but for someone that may be coming into the house is very important. And you can see as I completed that, it is showing as complete here. So anyone that is part of Harold's support circle, they will be able to log into the platform and see that has been done, which can be really helpful in the home care context when you have family members that are asking for that information, or if you have a handoff between different care partners to know what has been or what hasn't been completed. It just helps with that consistency as well. Another aspect is unscheduled maps that could be useful. So you may have knee pain or you may need help with hip exercises. So we have various experts who help with both seated, standing, basically these types of techniques to really help with dexterity and to help build those core muscles to help avoid falls. So here's just an example of what a video might look like on the platform.
All right, so for this first exercise, what you're going to be doing is starting in a seated position. You're going to be sitting up nice and tall, and you're going to put one of your legs forward, just like this. Doesn't have to go straight, just forward, all right? Now that it's forward, you're going to keep your torso nice and tall and bow gently until you feel a gentle stretch in your hamstring. You're going to hold this for 30 seconds, all right? Nice long hold. And then after you're done with that 30 seconds, You're going to switch legs. Nice long hold on the other side. You're going to go.
So I think you get the point. It can be used for rehabilitation. It can be used for those activities of daily living or instrumental activities. It really, anything that might help someone with remembering to, either take their medications or, to basically complete certain tasks at a particular time. It really, in a very visual and kind of multi-dimensional way, with sound and even the tactile aspect, when you have a push notification on your phone, you really apply and appeal to different kinds of senses. When we talk about that intake process, I wanted to just show you one example of how a wellness review works. Harold, for example, he was ex-military, and what these wellness plans are, it's basically a 1-hour assessment by one of our care navigators or dementia facilitators in this case, where we go through a 7-point set of questions. And this can be really helpful for educating anyone that is working with the individual on what their preferences are, who were they as a person, or who are they, and what are some of their needs in terms of on a daily basis. They have also abilities as well, and to be able to summarize a lot of these common things. What do they respond to the most? What kind of things within the environment are doing well, or maybe there needs to be a home modification. By going through this very systematic approach, it can help just understand what is best for that individual. So I wanted to just show you a couple of different key aspects I think would be useful in the older adult space. But let's also look at the intellectual and developmental disability space, because the needs and the use case are quite different. While the digital platform is accessible for professional care partners and even family members, we know sometimes the older adult space, they don't necessarily gravitate to technology as much. So a lot of that is more the behavioral, coaching and interacting outside of the platform. However, with intellectual and developmental disability space, you basically can't get people to get off of their devices a lot of the times, or just, children or individuals in general. They just really love and gravitate and want more self-direction in terms of how they do things. So let me just show you Andy's schedule, for example. He needs help with shaving. So what we did for him was really create a video and basically break down the shaving process, and really building these skills that can be used throughout their lives, where you have a visual, you maybe have text, you may
Starting
also
at
have
jawline
the
and
audio.
moving up, shave the other cheek and jawline. Move shaver with very light pressure in a circular motion.
So our occupational therapist created this. This is actually with her son, just as an example of how you can really break down a daily routine into the particular steps and really help with consistency of care. So I see a lot of, I haven't watched all the messages, but I'm glad that you see a way that this could potentially be useful. And we're really just getting started. We want to just get the word out and really make sure that this is something that could be beneficial for Alaskans or those really throughout the country, and get it in as many people's hands as possible. So my internet connection isn't working great, but there is video, like you saw with Dr. Marcus Rain on the physical therapy side, that will play. Gamification is a very important aspect that we're building in as well. When you think about reward systems, these are very important in terms of really establishing these habits and giving people motivation. So even to have something small where you say great job, or have your last step where it's their favorite song, those actually make a difference in terms of establishing a habit or not establishing a habit. It can be useful for gaining meaningful employment and staying employed, and partnering with organizations that maybe have a mandate or a mission to work with individuals with developmental disabilities. So, what's your checklist when you get to work? What are the things that you really should be doing, or sometimes you may forget? Maybe there's not 6 of these, maybe it's just 2 things that you need to remember, and you need a private way of getting access to that information. So these are just some, very basic examples of how MapHabit works on activities of daily living. They work in, your daily habits, routines, social stories. Some of you may be familiar with social stories to really help build that confidence in what to do in a specific situation. In this case, when working with other kids, and you have a tough confrontation, this can be something that's useful. So I see a lot of great chat going on there. I'm going to just pause of me speaking and want to see if there's anything else that the audience wants to bring up.
Yeah, I agree. There's some really great chat. So let's maybe, Matt, if you don't have any more to share, show us, maybe we can stop sharing the screen and then have everybody kind of continue those conversations that have been in the chat.
Yeah, I've got a question when you get a chance.
Yes, please, go ahead.
So I see this is on an iPad. Does it work on Android devices, and does it work on phones versus the iPad?
Yes, it does. So it works on Android, it works on phones. Let me turn down my resolution. Hopefully you can see MapHabit here. Kind of a similar content, just presented in a different manner. We actually are working on a laptop version as well. It currently works with an Android emulator, which it sounds complicated, but you basically just install basically on your laptop, and you can use MapHabit on your laptop as well for sourcing photos or content. Some people like to type on a keyboard, myself included. So a lot of different types of devices and form factors, which are the screen sizes. It's compatible with all the most popular ones.
And my mind is just exploding. I've got all kinds of applications for it. So I definitely, Jacqueline, I want you to connect us later, please.
Sure, absolutely, I will. So what I saw in the chat a lot is about workforce. I would imagine that many of the states that have partnered with you have really brought that forward as one of the key reasons that they're offering this to families at no cost. Can you maybe speak to any of the kind of conversations you've had about workforce and how MapHabit leverages, like Cindy was really explaining that the turnover is costly for the person receiving care. So maybe speak to that for a minute, Matt.
Yeah, workforce in the sense of the caregivers who maybe go to people's homes and that, yeah, it's a really high turnover in Atlanta. In the assisted living space, it's between 60% and 65%. I think nationally it's very high, maybe not that high, but yes, consistency of care, and not everyone has the same level of education. When you think about social determinants of health and health equity, not everyone has had a college degree. Maybe they are from a different country and maybe don't speak the English language as well. So what we've done is we have educational content basically converted into a 4th grade reading level, because that's CMS's standard, and have that available to educate caregivers so that they are better informed when sundowning is happening, or contracted hands. How do you help people grab utensils, etc. But even in other behavioral health space, sensory stimulation or different techniques with fidget toys or therapuddies, different kinds of cognitive engagement pieces. Those are just some of the out-of-the-box solutions, but really the power of it is the mapping out of these habits and personalizing the step-by-steps. You don't need 10 maps like these demo accounts have. You really just need maybe 1 or 2 things to start with. You'll see you'll get a lot of value pretty quickly. So hopefully that helps. It's consistency of care. It's potentially a way from a business development perspective to stand out a little bit from a another organization. But certainly, when you want to show appreciation towards your care staff, to give them more tools at their disposal, whether it be in this paper-based printout or in the platform that they can use in the moment at the point of care, I think all of them really can help.
Awesome. So Matt, Kim has a question. Kim, please unmute and ask, or I can ask it for you if you like.
Well, I can do it real quick. I know we're out of time, and Matt and I have a meeting already set up in July, so we can get into the details. I'm just so curious about the background, like if there's templates that already are set for routines and people just drag and drop photos or videos, if people really build it from scratch, kind of what that, are there routines already in there that you can pick? I was just curious. And we don't have a lot of time, and you can fill me in July, but I thought maybe other people would want a little snippet.
Yes, so we have a number of categories that are there: technology, social skills, school, physical exercises, leisure, recreation, those learning maps, job skills, home skills, health and wellness, food, nutrition, activities of daily living. There's 10 to 15 categories. Each of those has maybe, we have 790 maps. So each of those maybe have, 70 each, my math on the fly. But there's a starting point for almost any ADL, IADL, social story that is out there. And then we kind of have these cues on there, say like insert name here, or if it's a rehab exercise, it'll say update with reps and kind of how many rounds you're going to do. So yes, there's a good starting point. Every one of these maps can be, you can delete if it has 10 steps and you only need 1 or 2. You can delete those, and then you can create your own steps through taking a picture or a video or recording a family member voice, because maybe someone who's coming into the house, they don't know, but the person relates to that family member. So the power is building these and personalizing them, and using a smart device makes that a lot easier.
That is wonderful. So Cindy has said that, Cindy is an Alaskan through and through, but she's relocated to Arizona. So she has a lot of experience in this space. And so she's going to reach out. For those of you who need to leave, we totally get it. It's 1:30 but I'm going to hold on because there's so much experience here, and this conversation has been so energetic. I'd like to, Alice, if you don't mind, could I just call out to you? This is something that you actually did on your own for your daughter to help her live independently. So I just think your thoughts would be so valuable.
Oh my gosh, I am, can you guys hear me? I think I got everything turned on. I am really excited about this. I started out with 2 apps for my daughter, basic off-the-shelf apps. And a lot of what this is doing has taken it even to another level, it looks like. And I need to say about my husband died about 3 months ago. So I'm starting to think about what are the next steps for Kara once I leave this world. That's just my reality. And seeing something like this system makes me realize that I could easily share what I've done for Kara with a system like this, with the people that will need to follow with me. So I'm really excited to look into this a bit more and share it with other people. So I'm really glad I'm glad we connected with this today.
Wow. Well, this has been phenomenal. I mean, this is exactly why Health Tie exists. So thank you so much. Is there anybody else that would like to ask a question while we have Matt here? And of course, I will make as many connections as possible following this call. So. All right. Well, everybody is so well accustomed to ending at 1:30 that we just can't keep ourselves going on. So I just want to say thank you, Matt. Thank you. Obviously, you've really brought hope and ideas to this community. This is a challenge that's dear to our hearts. It's how Health Tie got started. And so what I'd like to do is just thank you all for coming. One thing that we've added is a director's minute, which always gets lost in in the mix, but just to say, I did go and have an opportunity to meet one of our presenters, Samir Pesapati, in person when I was just in Toronto, and it was awesome. Matt, you were able to meet with Jake Carpenter, one of Health Ties advisors. These personal connections that we're now able to do again are really valuable. You are welcome in South Central Alaska and Northern Alaska anytime you want to come back. I'm sure Southeast as well. Thank you all for coming. We have another presentation in 2 weeks. It's an exciting one that I'd like to tell you about because it's actually 3 engineers, one who is severely disabled, who has been he's managed to go through Stanford and create his own device. And it's kind of exciting. So I just want to point that out, that and that's AT Dev, and they'll be with us in 2 weeks. So please join us again. And thank you all. Thank you, Matt, especially. And I'll be doing those follow-up conversations. Take care, everyone, and we'll see you in 2 weeks.
Okay, thank you.
Yeah,
Thanks.
oh, and thank you. Round of applause to Matt, please. Thank you.
Thanks so much. I appreciate you all. It's been a pleasure. Hope to meet you all soon.
Awesome. Well, I'll hang out, and you're all welcome to hang out. And I know if you'd like, but thank you all for coming.